Hi everyone, welcome back to our channel. Today, we're going to talk about a virus that quietly spreads during the winter flu season, one that can fill hospital wards without making major headlines. It's not as famous as COVID-19, nor as familiar as the flu, yet it silently invades the respiratory systems of millions. In this episode, we'll discuss the forgotten virus, human metapneumovirus, or HMPV. You might recall that between late 2024 and early 2025, many parts of China experienced outbreaks of a respiratory infection easily mistaken for the flu, but in fact caused by the long-overlooked human metapneumovirus. As another flu season approaches, and although there are no specific warnings for 2026 so far, experts agree that HMPV will likely continue to circulate each late winter and early spring. To raise public awareness, this episode will help you understand one of the most underestimated health burdens in public health today. Let's rewind to the year 2001. 24 years ago, a team of Dutch scientists studying childhood respiratory infections isolated a previously unknown paramyxovirus from 28 young children. After analyzing its genetic makeup and comparing it with known viruses, they classified it as a new member of the metapneumovirus genus and named it human metapneumovirus. Before this discovery, the only known member of that genus was an avian virus. Even more surprising, serological studies revealed that by the age of 5, nearly all Dutch children had already been infected. This meant that HMPV had been quietly circulating among humans for at least half a century. Further molecular research confirmed that HMPV belongs to the Pneumoviridae family and the metapneumovirus genus. It is an enveloped, single-stranded, negative-sense RNA virus roughly 200 nanometers in diameter. There are two main genotypes, A and B, further divided into subtypes A1, A2, B1, and B2. These subtypes often co-circulate within the same season, with no major differences in transmissibility or virulence. Scientists suspect the virus originated in birds, but its exact source remains unknown. HMPV infections occur worldwide. Although infections can happen year-round, they peak in the winter and spring. The virus spreads mainly through respiratory droplets, close contact, or contaminated surfaces. Like influenza, COVID-19, and RSV, respiratory syncytial virus, HMPV is one of the most common seasonal respiratory pathogens across the globe. In North America and the Southern Hemisphere, it is most active in winter, while in tropical regions it tends to circulate during the rainy season. Clinicians often observe a familiar sequence. RSV rises first, followed by influenza, and then comes HMPV, three respiratory viruses forming the winter trilogy of seasonal illness. After infection, the incubation period ranges from 3 to 9 days. Common symptoms include fever, cough, nasal congestion, runny nose, and hoarseness, typical of mild upper respiratory infections. However, in certain groups, such as children, the elderly, and people with weakened immune systems, the virus can invade the lower respiratory tract, leading to bronchiolitis, pneumonia, or even acute respiratory distress syndrome, ARDS. These patients tend to have more severe symptoms, slower recovery, and higher mortality risks. As early as 2004, the New England Journal of Medicine published a landmark study showing that HMPV was the second most common cause of respiratory infections in hospitalized children, second only to RSV. By 2025, The Lancet further quantified its global burden. In 2019, there were approximately 473,000 HMPV-related hospitalizations worldwide, about 185,000 in high-income countries and 288,000 in low- and middle-income regions. The vast majority occurred among adults aged 65 and older. In the United States alone, in 2019, HMPV-related hospitalization rates among seniors reached 231 per 100,000, translating to about 122,000 elderly patients hospitalized due to this virus. At the end of 2024, HMPV once again made global headlines. On December 16, northern China reported clusters of HMPV infections. The virus spread rapidly, particularly among children. According to China's CDC, HMPV accounted for a significant portion of respiratory infections that season, alongside COVID-19, rhinovirus, and adenovirus. Within weeks, cases were also reported in India, Malaysia, and Hong Kong. Meanwhile, data from the U.S. Centers for Disease Control and Prevention showed a similar rise. Since November 2024, HMPV positivity rates reported by the National Respiratory and Enteric Virus Surveillance System (NREVSS) climbed from 1.7% in late December to 7.58% by mid-April 2025, showing a steady upward trend. Still, experts urge the public to remain calm. Scientists from the Global Virus Network emphasize that while HMPV is widespread, it does not trigger pandemics like COVID-19 or influenza. Nearly all children are infected at least once by age 5, and for most healthy individuals, it causes only a mild cold. Moreover, unlike the coronavirus, HMPV does not mutate frequently or give rise to more virulent strains. This means that although individual immunity may wane over time, there's no reason to fear an entirely new or unknown virus. Unfortunately, immunity after HMPV infection is not long-lasting, and reinfections can occur throughout life. Currently, there are no specific antiviral drugs against it. Treatment mainly involves supportive care, hydration, fever management, and respiratory support as needed. No approved vaccines exist yet, but researchers are exploring combination vaccines that could prevent both RSV and HMPV, two of the most common winter respiratory viruses. Moderna's NCT05743881 trial is testing two experimental mRNA-based vaccines, mRNA 1345 and mRNA 1365, aiming to protect infants aged 5 to 23 months against both viruses. Meanwhile, Sanofi's NCT06686654 trial targets adults aged 60 and above, evaluating a lipid nanoparticle, encapsulated mRNA vaccine for its safety and immune response against lower respiratory infections caused by RSV or HMPV. In summary, HMPV may not spark panic, but it serves as a reminder that public health threats often come from viruses we overlook. Its persistence teaches us that disease prevention isn't just a race against new viruses, it's also a long, ongoing battle against familiar ones. Understanding, monitoring, and preventing HMPV remain essential parts of our defense for respiratory health. That's all for today. If you found this content interesting and helpful, don't forget to like, subscribe, and hit the notification bell. Thanks for watching, and we'll see you in the next episode.